The world is once again facing the devastating impact of an Ebola outbreak. Behind the headlines are families experiencing loss, healthcare workers serving under extraordinary pressure, and churches that are seeking to be faithful witnesses of Christ's love amid fear and uncertainty. In this video, I'm joined by Dr. Kent Brantly, who brings both medical expertise and personal experience to this crisis, having contracted Ebola himself in 2014. Together, we'll discuss what's happening and how we can pray for those who are most affected. As followers of Jesus, we're called not to turn away from suffering, but to meet it with hope, courage, and compassionate care. Ken, thank you again for being a part of this conversation. While some people may know your story from the Ebola crisis in 2014, many aren't familiar. So why don't we begin with a little bit of background? Can you share that story briefly?
Sure. In 2014, my family and I were living in Monrovia, Liberia, serving as medical missionaries at ELWA Hospital when the Ebola outbreak started in the country of Guinea and quickly spread to our area in Monrovia. And our hospital became the primary treatment center for patients with Ebola in Monrovia, which is a city of about 1 million people. And as one of the employees of Samaritan's Purse working in that area, I was appointed as the medical director of our Ebola treatment unit. And over the course of several weeks of taking care of patients with Ebola, one day I woke up feeling not well, and over a couple of days really got sicker and sicker and eventually tested positive for Ebola myself. I was treated there in my house on the coast of Liberia for about 10 days, treated by my colleagues, my teammates, my friends, who would put on the PPE and come into my house and take care of me. Thankfully, my family was not there at the time. My wife and children had returned to the States actually just 3 days before I woke up sick. They had returned to the States in preparation for a family wedding that we were all supposed to attend together. I was supposed to be following them about a week later. After being treated for about 10 days in my house in Liberia and getting very close to the point of death, I was very, very sick. An experimental medication was made available to the team that was taking care of me. And I truly believe there were millions of people, of Christians around the world praying for me. And God saved my life. And an evacuation was made possible, something that had never been done before, to transport a patient sick with Ebola virus disease across international borders. And I was evacuated from Liberia to Atlanta, Georgia, where I was treated for another 3 weeks at Emory University Hospital by a really skilled and compassionate team there at Emory. So in all, I was in isolation for about a month. And I thank God that I survived and made a full recovery. And in the wake of that, my wife and I saw an opportunity that we were given a platform really to speak out as advocates for the people of West Africa who were suffering from this outbreak that was really, it was still in its earliest months. It ended up lasting almost 2 years. But so we spent the better part of the next year speaking as advocates for the people of West Africa, calling for people to pray for an end to the outbreak, and to pray for those who were suffering, those who were losing loved ones. And and calling for medical professionals to volunteer to go to the front lines and serve those in a place of great need, to help save lives. That really is our story in a nutshell. And
What, first of all, we join God in giving thanks once again, as undoubtedly many have, and you and many have over the years, for sparing your life in this way. I imagine that your experience as a medical caregiver versus one receiving care, particularly with an issue like Ebola, gave you a different perspective, or at least shaped you in some way. Can you speak to that, of that shift of perspective from giving care to receiving care?
sure. I think the two are, my experience is kind of a double-edged sword. On one hand, I did have experience of caring for patients with Ebola. I think at the time I became ill, we had cared for about 20 patients who had tested positive for Ebola. There were thousands that would follow. But of those 20, we had only had one survivor. So when I became a patient, I had that perspective as a physician of having seen my patients go through all the same symptoms that I began to see happening in my own body. And that was, frankly, it was terrifying. My experience as a patient, as one being cared for, is incredibly humbling. Some might say it's humiliating, and in some ways it can be, especially with an illness like Ebola, where you really lose the ability to do anything for yourself. You lose control of your bodily functions. You are completely at the mercy of those who are caring for you. But it's also very humbling to be in a place that feels so helpless and to receive the kindness and the mercy of those who are there, putting themselves at risk, really, to care for you, to tend to your needs, to seek treatment for your illness, is incredibly humbling. I've had the privilege of encountering some of the team members who took care of me from Emory repeatedly over the years, now 12 years. And I feel such a debt of gratitude to those people who took care of me. I've also continued to work as a physician, and in early 2020, actually March of 2020, I began work at Mukingi Mission Hospital in Kasempa, Zambia. Again, moved there with my family, planning to serve long-term in that place. And Zambia began to experience COVID the week that I started working in the hospital. And my experience, having been a patient during that Ebola outbreak, absolutely impacted my connection to the patients I took care of in our COVID unit. It changed my relationship to them as a caregiver, because I remembered being that patient, feeling completely helpless, isolated, and needing someone to take care of me. That reality is played out over and over again every day around the world, but it's easy to see that reality playing out in the Ebola outbreak in Central East Africa right now, in DRC and Uganda. I think of the thousand. I think the number's up to 1,200 now at the time we're having this conversation. 1,200 confirmed cases of Ebola and over 300 people who have died. I'm mindful of those people who are in that position of humiliation, isolation, and desperate need for someone to offer them compassionate care.
It seems that the offer of compassionate care would be the same then and now. Are there things that are different between the Ebola outbreak in 2014 that you experienced and what's happening right now?
I'm certain there are differences. It's happening in different country, in different countries, in different cultures. Um, I honestly, I see a lot of similarities. So from 2014, from the time I got sick through the end of that outbreak and through the 2 or 3 or 4 other Ebola outbreaks that have occurred since that time, there have been tremendous advances made in our ability to prevent and treat Ebola virus disease. There's a vaccine. There are therapeutic agents that reduce mortality, that increase people's likelihood of surviving. But those vaccines and those therapeutic agents have all been made to target the Zaire strain of Ebola, which is the strain I had, the strain that caused the over 11,000 deaths in West Africa. But this outbreak now in DRC and Uganda is the Bundibugyo strain. It's a different strain. It has maybe a slightly lower mortality rate than the Zaire strain. But the thing that makes this so similar is that here we are in a place that has suffered greatly from armed conflict, millions of displaced people living in internally displaced people's camps, refugee camps, a place that is very difficult to navigate geographically and culturally, societally. There's so many divisions and different conflicts taking place between governments and non-government militias and rebel groups. And we have no targeted treatments. We have no known effective vaccines for this strain. So those factors make this feel very similar to the outbreak that happened in West Africa a dozen years ago. I think DRC, the Democratic Republic of Congo, is the place where Ebola was first discovered in 1976. They have the most experience. I think this is maybe the 17th outbreak of Ebola virus disease to occur in the Democratic Republic of Congo. But this outbreak is different than the ones before it because it's a different strain, because of the area in which it's happening, where there's already so much suffering and conflict. And it was identified so late. There were already lots of cases and a wide geographic spread before the outbreak was identified as Ebola virus disease. And I think that's why we're seeing it grow so rapidly. It's been just a little over a month since the outbreak was first identified, and we're already at over 1,000 confirmed cases and over 300 people who have lost their lives. It really concerns me that this could turn into a protracted outbreak like the one we saw in West Africa, like the one I was a part of. And it breaks my heart to see that, and in some ways to feel helpless to do anything about it.
Kent, I'm struck by how you've described a situation that there are differences, the medical advances, and yet because it's a new strain, The similarities are what strike you, the complexity of the socio-political situation, conflicts that you've described, complexity of getting care to the places that are necessary, global attention, and the fact that while the advances have been made, in some ways we're starting over again with the need to find appropriate therapeutic responses, much less a vaccine. In the face of such complexity, which you know firsthand, what is one thing that you would wish for church leaders and Christians to do? And what is one way that we could pray?
Thank you for that question, Walter. It's a challenging question because there's so many things that could be done. There are Christian healthcare workers all over America who may have the ability and the capacity, the opportunity to join the response by signing up with one of the organizations that is involved on the ground there, with Samaritan's Purse or Doctors Without Borders or International Medical Corps, whatever organization someone might have a connection to that they could serve with. There are lots of ways that people could donate money to help support and fund this response, because it's going to require a lot of international aid to trace contacts, to identify patients, to provide for the transportation of the teams there on the ground, to provide food for patients in hospitals who are being cared for Ebola or for any other medical condition that's requiring them to be in a hospital during this time. The whole healthcare infrastructure is under great strain in a situation like this. But I think one thing that most Christians in America could do is to simply set up a Google alert email for Ebola virus and pay attention to the news. Pay attention to the reports that are coming out of Central and East Africa and pray for them. It's very easy to forget about what's happening on the other side of the world. Out of sight, out of mind.
Mm.
And we have so much happening in our own country right now. So many divisions, so much in the daily news cycle that wants to occupy our attention. Find some way to bring this outbreak to your attention on a regular basis so that you can remain faithful in prayer for our brothers and sisters who are suffering, who are struggling in this response, who are trying to offer that compassionate care, for the communities that are being assaulted by this invisible enemy. These people in places like Ituri province, they're very familiar with armed conflict. You can hear the gunfire, you can hear the rockets and mortars, you can see the people who are shooting those guns, and you can run away from them and hide from them. But in an outbreak of a contagious illness, there's nothing to see, there's nothing to hear, and Ebola is known as a caregiver's disease because someone gets sick and the people who love them tend to them and care for them in their illness. And then those caregivers end up contracting the disease themselves. We need to be praying for those people who are in those tough spots, caring for their loved ones, putting themselves at risk. And if we're going to really be faithful in prayer for them, we have to be mindful of them every day. So set up a Google alert email for the term Ebola virus and pay attention to the news so that you can pray.
Dr. Brantly, thank you so much for sharing your story, sharing from the wisdom of that experience, redeeming the difficult elements of it, and then giving us some really practical ways to stay informed and to stay prayerful.
Walter, thank you for this opportunity. Thank you for the work you and NAE are doing to shed light on this situation. So often we only hear about these things in the news in a way that is fear-mongering and feeds our tendency towards self-preservation. But Jesus went to those who were suffering. He laid hands on the leper and said, I am willing, be clean. We need to be like Jesus. We need to move towards those who are suffering and not run away from them. So thank you for directing us back to Jesus and his example. And thanks for this conversation.
Thank you for ending us on that note. To God be the glory, and may his mercy be brought to bear.
Amen.
Amen.